All right, so here we have chapter 16, the urinary system. It's a simple chapter, but it's a little complex with how it functions, but we're going to keep it pretty simple. Here is the outline that will follow. The main function of your urinary system is to eliminate waste through excretion, and that's through urinating. So this is elimination of wastes and excess substances from the body, and these metabolic wastes include CO2, carbon dioxide, water, heat, salts, and all nitrogen-containing wastes. Several organs eliminate wastes and excess essential ions. Your lungs eliminate heat, water, and carbon dioxide. Your skin eliminates these wastes. The organs of your GI tract, which we just covered, eliminate solid wastes and some metabolic wastes. But your kidneys will form urine, which is a mixture of water and solutes that will eliminate these wastes seen here. So here's a look at what each kind of body system eliminates. And again, we are in the urinary system right here. The urinary system consists of 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra, and it functions to regulate your blood volume, pH, pressure, and the composition of the blood. The kidneys regulate the amount of water and dissolved substances that are removed from and returned to the blood, and substances that aren't returned back into the blood will form your urine. Your ureters transport urine from kidneys to bladder, where the bladder stores the urine, and then the urethra is what transports the urine from the bladder to the outside of the body. And you can see here the anatomy of the urinary system. Kidneys are reddish brown in color. They're shaped like a bean. They're about the size of your fist. They have 3 regions: the cortex, the medulla, and the pelvis. Nephrons are the functional unit of the kidney, and they are responsible for the formation of urine. And each nephron consists of a renal corpuscle and a tubule. So here's a look at the kidney. The cortex is the outer lighter layer, and the medulla is this inner layer made up of what we call renal pyramids. And here is the renal pelvis, which will serve as a collection station for all the urine that's formed within the nephron, which is this structure shown here. The renal corpuscle is the site of filtration, and it will consist of a glomerulus and a glomerular capsule. The renal tubule is the site of reabsorption and secretion, and it consists of these 3 sections: the proximal convoluted tubule, the loop of nephron, or the loop of the nephron, or loop of Henle, and the distal convoluted tubule. So here's a look at the glomerulus. So it'll have an artery that brings blood into the glomerular capsule, which will filter everything out of the blood, and then that filtrate will go through the proximal convoluted tubule, loop of the nephron, and then the distal convoluted tubule, where things will be added to the urine or extracted from it, and then into what we call the collecting tubule, which is right here. You have different capillaries and blood vessels that surround the tubule system to absorb things back into the blood. The nephrons form these functions: glomerular filtration, tubular reabsorption, and tubular secretion. Glomerular filtration occurs as blood pressure forces water, ions, and other small molecules from the blood in the glomerulus to the space inside the glomerular capsule, and the concentration of that filtrate within the glomerular capsule is then close to that of blood. So here's a look at the wall layer and how things get filtered from the blood capillary into this capillary space. Tubular reabsorption removes useful materials from the filtrate as it passes through the proximal convoluted tubule, and about 99% of the filtrate will be returned back into the blood. Then tubular secretion removes wastes and excess ions from the blood, and it occurs along the proximal and distal convoluted tubule. So this shows you how much of a substance is filtered per day by the nephron. So 180 liters gets filtered a day in your kidneys, and then the percentage that's reabsorbed or removed from the filtrate and returned back into the blood. So creatinine is all excreted. Urea, about 50% is excreted. 100% of glucose is reabsorbed back into the blood, and 100% of bicarbonate ion is. So you shouldn't see glucose in your urine, that would be a sign of problem or concern, and most water is also reabsorbed back into the body. Here's a look at the lumen of a tubule showing how microvilli of the cells lining the tubule greatly increase the surface area for absorption. Kidneys help regulate blood pH by returning bicarbonate ions to the blood during tubular reabsorption and by removing excess hydrogen ions from the blood, generating new bicarbonate ions when the cells of the proximal convoluted tubes metabolize glutamine. And again, this is important for regulating blood pH. So you can kind of see this process shown through here that happens in the nephron of the kidneys. From glomerular filtration to tubular reabsorption and to tubular secretion. Nephrons with long loops that extend into the renal medulla are for conserving water and maintenance of high solute concentrations in the interstitial fluid within the renal medulla is key. It leads to water moving out of collecting ducts for conservation by the body, and it leads to production of concentrated urine. So you can see what things are absorbed and secreted in each part of the nephron. Our health depends on keeping the salt and water levels in our body near certain optimum values. And these are the hormones that are responsible in adjusting kidney function: aldosterone, antidiuretic hormone, and atrial natriuretic peptide. Aldosterone is released by your adrenal cortex to increase blood volume and pressure, so it will produce concentrated urine. ADH increases blood volume and pressure and also produces concentrated urine. And this just shows how a decreased concentration of water in the blood will tell your hypothalamus to act on your anterior pituitary gland to release ADH. By the posterior lobe, and that ADH will cause increased permeability to water in the collecting ducts, causing more water to be absorbed back into the blood, and that'll increase the concentration in your blood. ANP decreases blood volume and pressure, and it produces a more dilute urine. So this will decrease reabsorption of sodium, resulting in more sodium and water remaining in the filtrate, so you'll urinate more frequently. So this is a look at those hormones and their effect on water and solute reabsorption. You should know which hormone increases or decreases blood volume and pressure and the type of urine that's produced. Kidneys have two homeostatic functions unrelated to the urinary system. They release erythropoietin, which tells your red bone marrow to produce red blood cells, and they also transform vitamin D into its active form, calcitriol, and that promotes the absorption and use of calcium and phosphorus by the body. Renal failure results in when the glomerular filtration decreases or stops. It can be acute or chronic, and the consequences can be acidosis, too high of pH levels or too low of pH levels in the blood, anemia, edema, is swelling, and hypertension, or accumulation of nitrogen-containing wastes. So if your kidneys fail to function, they really affects the rest of your body. Treatments are hemodialysis, which uses artificial devices like a kidney machine to cleanse the blood, continuous ambulatory dialysis, which uses the patient's own peritoneum as the dialyzing membrane, or a kidney transplantation, which is kind of the last thing you want, but it's the ultimate hope for many people whose kidneys fail. So here's someone going through dialysis, being hooked up. All the blood will travel through that machine, get cleaned out, and then return back to the body. Here's a look at a donor kidney and where it might be located in order kind of to find a space for it in the body. There's a look at a kidney transplantation. You're able to live with one kidney. So I've known of many people who have donated one of their kidneys to a friend or a family member. Urination is the process by which the urinary bladder is emptied. It includes both involuntary and voluntary components. So some things you can control and other things you can't. The internal urethral sphincter is involuntary, but what you control when you go to the bathroom is the external urethral sphincter. So this just shows When the bladder gets full, it sends a stimulus to your nervous system, which tells, hey, the bladder's full, it's time to release it. And that internal urethral sphincter will relax to release the urine flow. The external urethral sphincter, then that's what you control to release the flow of urine out of the body. Urinary incontinence is lack of voluntary control over urination. It's very normal for infants and toddlers. Stress incontinence is more common in women, and urinary retention is the failure to expel urine from the bladder to a normal degree. UTIs are caused by the presence of microorganisms where bacteria can enter the urethra from the rectum or as an STD. It's more common in women than men. Symptoms include fever, blood in the urine, very painful and frequent urination. And it's very important to treat it with antibiotics to prevent spread of a UTI to your kidneys. So the shorter length of the urethra in females is usually responsible for the greater susceptibility of females to urinary tract infections. You should be able to, from this chapter, do all of these things, and I hope you guys are doing well. Thanks for listening.